Can hysterectomy type reduce surgical complications in cancer? When it comes to treating cancers like cervical and reproductive cancers, the type of hysterectomy performed can indeed influence surgical complications. Different approaches to hysterectomy, such as open hysterectomy, laparoscopic hysterectomy, robotic hysterectomy, simple hysterectomy, subradical hysterectomy, and radical hysterectomy, each have their own profiles of risks during and after surgery. Open hysterectomy, which involves a larger abdominal incision, tends to have fewer complications during the surgery itself. This is because surgeons have direct tactile feedback and a clearer view of the surgical field. However, this method is associated with higher rates of postoperative complications. These can include infections, blood clots, bladder dysfunction, bowel obstruction, and lymphedema. The larger incision and the greater trauma to tissues contribute to these risks. On the other hand, robotic hysterectomy is a minimally invasive approach that has shown the lowest rates of postoperative complications. The advanced technology allows for 3D visualization and precise instrument movement, which reduces tissue damage and leads to quicker recovery times. While robotic hysterectomy is generally safe during surgery, it may still carry some intraoperative risks, particularly if the surgeon is less experienced. Laparoscopic hysterectomy, another minimally invasive option, has the highest intraoperative complication rates among these methods. This is often due to the challenges of instrument manipulation and the learning curve for surgeons. However, the postoperative complications are usually moderate and less than those seen with open hysterectomy. When comparing simple hysterectomy to radical hysterectomy for early-stage cervical cancer, simple hysterectomy has significantly fewer surgical complications. These include fewer bladder injuries and urinary issues. Importantly, studies show that the recurrence rates and survival outcomes are similar between the two methods in low-risk early-stage cases. This makes simple hysterectomy a safer choice with better quality of life for patients. Subradical hysterectomy has also been linked to fewer early postoperative complications compared to radical hysterectomy in certain endometrial cancers, while still achieving similar survival rates. Surgeon experience plays a crucial role in complication rates, especially for minimally invasive procedures. As surgeons gain more experience, the rates of complications tend to decrease. In summary, the type of hysterectomy chosen can indeed reduce surgical complications, depending on factors like the stage of cancer, the patient's overall health, and the surgeon's expertise. For early-stage cervical cancer, less invasive options like simple hysterectomy can minimize complications without sacrificing oncologic outcomes. Minimally invasive techniques like robotic hysterectomy can lower postoperative complications but may have high risks during surgery if the surgeon is still learning. Open hysterectomy is safer during the procedure but can lead to more issues afterward due to its invasive nature. It is important for patients to have personalized discussions with their healthcare providers to determine the best surgical approach for their individual needs.